The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show, we'll be talking about the State Mental Health Ombudsman. An ombudsman is an advocate for an individual in their dealings with different organizations, and this organization is Mental Health Outfits. He helps to advocate for that person so they can have an amicable outcome if there are some issues that come up. But there's other ombudsmans throughout the state too, and they're all working for you, so stay tuned.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm Brian Lamore, your host. I mentioned that we're talking today about the Mental Health Ombudsman. We have an individual that works out of the governor's office that advocates for individuals that are involved with our mental health system. He helps to advocate for them and hopefully resolve any issues amicably that come between the individual and the organization. He's kind of a third party that is an advocate for that person. Joining us today is Dennis Nyland. Welcome to the show. It's great to have you here.
Well, thank you very much. I appreciate it.
Great. Well, you're the Montana Mental Health Ombudsman, and let's start at the top. What's an ombudsman, and why are they important?
Yeah, so the ombudsman, it's basically came from Sweden back in, I think it's 1809. What it was an individual or a mediator between the citizens and the king. From that, it actually came to North America. Canada's been doing it for quite a long time, more than we have in the U.S. So basically, what an ombudsman is basically that mediator between citizens and government. So or that liaison or representative for individuals.
Yeah. So you have to have a lot of knowledge in the field that you're in. But now there are several ombudsmen that are in the state of Montana with different groups that they advocate for. Who are they, and what do they do?
All right, yeah. So we actually have three types of ombudsmans in our state. There's multiple ones in other states, but we actually have the Child and Family Ombudsman, and their job is to be that liaison between the CPS system and the Child Protective System and citizens of Montana. We also have the Senior Long-Term Care Ombudsman, and their job is to be that liaison for the individuals that are residents that are in assisted living or in nursing homes and government and to help them through if they have any complaints or issues.
Yeah.
And then you have my job, which is the mental health ombudsman. There's pretty much two parts to my job. One part is I help people find any kind of resources they're looking for as far as mental health. So it could be an organization, it could be a facility, or it can actually be a provider. Of course, if you're in a bigger location, a bigger city or town, and you have multiple providers, for example, I'm going to give them the whole list of providers that we know of and let them pick which one they want. But we will give those resources to them. Uh-huh. And then the second part of it is, and more of the ombudsman piece, that liaison, is if anybody has an issue, a concern, or complaint with the Montana mental health system, they can call our office, and we can hopefully be that liaison or help them to try to resolve that issue with whatever the issue or complaint is.
Mm-hmm. I know in the senior and long-term care, we had the senior long-term care ombudsman, and I remember in trainings with Kelly Morse, who was the head of that then, the question she would ask, what rights do an individual lose when they go in a nursing home? And the answer is, you don't lose any.
No.
Right.
That's what they're there to do, is to help them when there is an issue or a concern that comes up. So,
You advocate for their rights. And now, when we talk about advocating for an individual's rights, do most of the people contact you that are in the system, or is it family members? And is there a different approach to your job if it's a family member that's contacting you versus an individual?
So, great question. Actually, we get both. A lot of them, I would say probably more on the family or loved ones are calling about someone that is, that they have a loved one that's might have a mental health diagnosis or dealing with a mental illness, and they're trying to find out what they can do to help them. I mean, the biggest thing with that is to let them know that, these are the steps you can do. One thing people have to realize too is someone that has a mental illness, it's a medical condition, right? It's just like diabetes, or it's just like cancer or whatever. So they have rights too. So individuals, family members that call about individuals, we want them to help them, but they have to also know that it's not against the law to have a mental illness or to be mentally ill or dealing with your mental illness. But hopefully we can help them find a solution before we have to have other entities get involved with them.
Mm-hmm. Well, now let's talk particularly about the history of the mental health ombudsman. How did it come about, and I guess why was there a need for it that they said, we need you?
So it actually started in 1999. The legislature came up with, it was originally called the Managed Care Mental Health Ombudsman, about 2003-ish. They got rid of the managed care. We kind of got away from that, and so it became the mental health ombudsman. And basically there was issues, there was things going on with the mental health system, and they wanted someone to be able to be that individual to help citizens with those issues that are dealing with the mental health system. It has a lot to do with the mental health parity, when that came about and everything else, making sure that they were being respected and actually getting the help that they need, and so that they asked our office or the office is created to help with those issues.
So you're an advocate for individuals in a kind of a narrow slice in the health facilities that they're experiencing services, I guess. I mean, I help with that. We have the Mental Disabilities Board of Visitors, which they do the site inspections of like the mental health facilities around the state. But I work alongside with the Board of Visitors also. But I do help with those issues too. Yeah. So. When I say we, how big a staff do you have?
So we have a full-time, myself, and I have a part-time person that works with me and does a great job. But we have 1.5 FTEs for the whole state, but we do the best that we can do with it, and I think people are happy to have us.
Well, that's great. We've gone to a close on our first segment here, and we're talking about mental health ombudsman, an advocate for individuals and for the families who love those individuals that are involved in our mental health system. They help to assure that their rights are being met and maybe educate both the facility and the individual as to what some of the parameters are for getting adequate mental health. We got a lot more to talk about. Stay tuned. We'll be right back.
Perhaps Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle that was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons has been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her. Welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about the Montana Mental Health Ombudsman. This is an individual that works with individuals in Montana and with service providers that address mental health issues. Rejoining us is Dennis Nyland, and welcome back to the show, or this segment. But let's kind of start at the top. You're an advocate, and how do you do the advocacy, and maybe how does that tie in with your agency's mission?
Yeah, so when I say advocate, we are advocating for people. And I would say that our advocacy is that we can't, because I only have a small staff, I can't go to different cities and advocate personally for them. So what I encourage, or we encourage, is self-advocacy. And we give them some of those resources to be able to help do that if they want to be their own advocate. But we also, if they don't have that capacity or they don't know what to do, we'll find those resources that can help to advocate for them, to help them through the system.
That's great. And you talk about the individual working through the system, but many times there's a family behind them, loved ones that are equally concerned. Maybe they're a third party. They're concerned about the person and the organization. How do you assist those families that care for those?
Yeah, so like I said, earlier, the individuals, when we have some individual that calls in, we try to help them with that, with whatever issue it is. But like I said, the family member is just as important, if not the most important, besides getting the treatment or getting the facility or whatever wherever they need to go. So talking with the family members and talking with the individual is paramount. I mean, if we want to talk to both of them. We want to work as a team, or have them work as a team, because they're the ones that are living with them or are working with them on a constant basis. I'm not.
Yeah, and they love them, and they want to see some help with some issues that are happening. So individuals can give you a call, and they've got a telephone number and a website. But to generalize, what are some of the inquiries? I mean, what's kind of the top common questions that they might be asking about or asking for resources on?
Yeah, we have. I have a list of, I think it was like about 8 or 9 different ones. But the top 3 or 4 is access to services. So the mental health services, as we know, we're still dealing with making sure that we have the services out there throughout the whole state, right? We're dealing with that. So that's one of them. The second one is the availability of those services. So let's say we got some services for them, but it might be a week, 2 weeks, 3 weeks out before they can actually have those services start.
Yeah.
So it's that trying to help them to figure out what they can do in between when they finally get those services.
Yeah.
And the third one is like the legal and the criminal justice system. So we get a lot of calls from the jails, with individuals that are dealing with their mental illness, and they're in jail, or in a correctional or detention center, right?
Yeah.
And with that, they're not getting those services because you're not out in the public, you're not out in the society to where you can go and just go to a services.
Yeah.
So it's working with them and working with the jail staff and the detention staff to see if we can make sure they're getting the services that they need for their mental health.
Yeah, I can certainly understand that. That brought up a thought, is that some people said that with services nationally over the years have been really going down, so that a lot of our mentally ill are now incarcerated, and do the services get to them in prisons?
Yeah, and I guess what I would like to say, I mean, there's three things that we look at. We want to make sure, we don't want them to necessarily go to the emergency room.
Right.
We don't necessarily want them to go to jail. If they have a mental illness or a mental health issue going on, we don't want, the jail's not the answer, or prison.
Right.
And we don't want them to go to Warm Springs, which is our mental health hospital, right? Our mental health hospital. Those are the three highest cost of care.
Yeah.
So we're spending a lot of money to send them to those different things. So our goal is hopefully to get in the different communities to have those either crisis stabilization facilities or receiving facilities. So a facility where they can go to, so they're not going to jail, of course, or going to the ER, or have to go to Warm Springs or to the state hospital to get care, where they can get care in the community. So that's what we work towards that too.
Right. Now, the examples you just mentioned, I'd say they're kind of crisis situations, and our system is burdened with not a lot of vacancies, but you'd like to catch them before they get to that point. How do we work to meet the needs of the mentally ill before they wind up in a crisis center, hospital, prison, jail?
So education, obviously, there's a lot of different things out there. There's a lot of information that goes out there. When we get calls, we definitely educate either the individual, a lot of times more the loved ones or friends or family that are calling and saying, have you tried this? Have you tried, get a hold of this organization, NAMI, National Alliance for Mentally Ill. They're one big one that they have different programs. They have a family to family, and they have different things how to work with your individual that has a mental illness.
Yeah.
So we try to educate or to get that information out ahead of time, like you said, so a crisis doesn't come up. Or if it's on the cusp of a crisis, hopefully we can get enough information there to be able to give the family members or that individual enough information to know, okay, either see if you can go get the help that you need, or here's some things you can do to help deal with that so that doesn't become a crisis.
And I imagine that you got to be very persuasive, because the individual in crisis is thinking one thing, the families are thinking another.
Yeah, 100% active listening, which basically, it's pretty funny. I'll say it. I do teachings on active listening. It's basically shut up and listen.
Yeah.
You need to be quiet and just listen to what's going on with them, because you have to be able to help them, to get the help that they need.
Yeah, because they're not going to listen otherwise.
They're not. They're
right.
not.
Well, that is so good. And communication, that's always in my mind. Communicate, and we've got to learn how to do that better. And now we've drawn to a close on our second segment already, and we want to communicate more with you in our third segment as to resources and, I guess, opportunities, how you can help individuals with mental health issues with the Montana State Mental Health Ombudsman. So stay tuned.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Hi folks, welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're talking with the Montana Mental Health Ombudsman. And Dennis, when you have a call from somebody about mental health issues, there are 4 options that many times you look into. What are some of those options, and why is it important for our viewers to know what options are?
Yeah. So when someone calls, I mean, really there's 4, like I said, 4 things that we can help them with, basically. Yeah. First one is like coaching or give them information. They could be calling and asking. It could be about mental health. It could be something else. They might have got the wrong number, but yeah. I will help them with whatever. I mean, if they're looking for another agency, I will help them with that. But
no wrong door.
So basically that coaching and just help them through and understand. I have an understanding of what they're dealing with and what's going on so that I can give them the best information they need.
Yeah.
Secondly, it would be like a referral. So if they're looking for a mental health facility or organization or whatever, then I'll give them that, like I said before, that list or the individuals to get a hold of. If it has something to do with other than mental health, or it's another department or of the state, I might give them that. I'll give them that information so that they have that. So it's like a referral to another agency.
Yeah.
Because my office won't be able to handle that or deal with that. The other one would be like an informal assistance, which I kind of talked about a little bit on that, is if it's something totally off the cuff that has to do with mental illness or mental health, I will look up and help them get through that issue, that situation. I can look on the internet, or I can do whatever. I can give them a call back and give them the information that they need, or individual they can call. And then the other one would be just providing any kind of, I call it other, it could be anything where they're, maybe they want to have, more training on how to deal with their individual or their loved one, which would be NAMI, or if they have issues, someone suicidal, I'll give them the options they can do with the like suicide trainings that are out there to help them to understand suicide and how to prevent it.
Great. When you're saying that, I remember an old term in the government we had was no wrong door. You get contacted, the resources, where to redirect them, so you just don't say, I don't know, good luck, goodbye, which is great to do that. But now, how do people get a hold of you? Are you pretty easy to get a hold of?
Yeah, so there's quite a few ways to get a hold of us. You can get a hold of us by phone, the old phone, calling on the phone. You can do it by email. There's an email address that we have for that. We actually have a Facebook that people can go on there. The way we have it set up is you can ask questions to us, and then we have it set up so that we can talk to you directly, that we're not going to have it going out to everybody else.
Oh, yeah.
So you can respond to us, but we don't let that go out to everybody else. Let's keep that confidentiality there. And then we have our website. So just if you type in Montana Mental Health Ombudsman, it'll bring you up to the page, and that gives you resources. It gives you news and like some current news that's going on with mental health, articles, and then also you can send an inquiry into us. And if you don't want to do email, you can actually do it through the website. And then we'll get that, and we can get a hold of you and help you with whatever you're doing with.
So all the modern ways you can get contacted, you can talk to them,
yes.
Communicate. Now, when you talk about mental health, usually it's at a time of crisis, is that when you hear about it, if it's other third parties. And Montana, and you have helped bring to Montana crisis intervention teams. What is a crisis intervention team, and how do they help individuals?
Yeah, and I'll do this in a quick nutshell, but basically in Memphis in 1987, there was an incident that happened. An individual was dealing with a mental health crisis, had a knife, and was ready to hurt himself and hurt other people. They ended up shooting him and killing him. It's not the first time it's happened in the United States or in Memphis.
Yeah.
They created this training to help law enforcement to understand what people dealing with mental illnesses, what they're dealing with, or crisis, what a crisis is. And then they created a de-escalation type training.
Yeah.
So from that, CIT, if you look up CIT or Crisis Intervention Team Memphis model, it's the gold standard for the U.S. Supreme Court. So there's case law that says if there's multiple crisis de-escalation trainings out there.
Yeah.
But if it's the gold standard is the CIT Memphis model. And then, so basically, back in 2004, 2005, I was with the sheriff's office, and I went to Memphis, and I learned about this. We came back, a group of us came back, and we started CIT in Montana in 2005, and we've been going ever since. Right now, we have a nonprofit organization called CIT Montana that we coordinate all our coordinators throughout the state to help produce these trainings throughout the state for law enforcement and first responders, or anybody in the crisis service system.
Interesting. So if they would like information, they can give you a call in your various routes, and you'll probably get them to a local community CIT training.
Yes. Or
information so that they can have the tools to work with these individuals. Does that come down to families, or is this more of a professional training?
So we've had like peer support individuals, we've had family members be in there. It's more for the people that are in the crisis system. So, but if there's family members, we've had family members that have been in there. We just want to make sure that they understand what the training's about. But yeah, we've had family members too.
Okay. Well, now we just have about a minute left. And for our viewers, what would you like them to remember about this interview with you and mental health services in Montana?
Yeah, I guess I want to say the mental health system, we know that we have a lot of work still to do with the mental health system, not just in Montana, but the whole United States. So I want people to know that they can call my office. We can help them get through if there's something going on with the mental health system, or if there's a crisis. Of course, if it's a crisis, you're not going to always get a hold of me. But if there's something that you need help with, get a hold of me. Like you said earlier, if you call my office and it's not about a mental health, or it's something that they weren't sure who to call, I will help them find the right person. That's just how I operate. That's how we need to make sure that we're helping people. So, yeah, just get a hold of my office, and we'll do whatever we can do to help you.
That's great. Well, Dennis, thank you for your service to Montanans, and we really appreciate you being on the show here.
Thank you very much. I appreciate it.
And for our viewers, there's two numbers. 988 is our suicide prevention hotline, and 911 if it's a crisis. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.